Hello, everybody. Today we have a very special guest with us, and he's Dr. Pankaj. He's a consultant urologist at University Hospital in North Midland in the United Kingdom, and he just got his first COVID vaccination dose. So I just thought कि let's share his experience with everybody so that we know कि जो हमारे common apprehensions हैं about the vaccines. So I think we will ask him few questions about his vaccine experience and we will see कि जो एक common concerns या common doubts हैं so that masses can be aware of all these doubts और हमारा scare कम हो जाए. So I welcome Dr. Pankaj and first of all I will yeah. First of all, I would like to thank you, for giving us a really valuable time. I understand you are in hospital right now, but still you managed to spare some time for us, and I really appreciate that.
No, thank you, Vineet, for giving this opportunity, and really appreciate you asking me to share my experience. I hope my experience is able to help people out there, and I can share my experience from UK. The vaccination drive has started recently, and it will be good to clear some doubts from for the people. Yeah, I'm very happy with that. Thank you.
Thank you. So, सबसे पहले, the most important question: how was it? You were vaccinated. When were you vaccinated for the first dose?
So I got my first vaccination dose around a week back, less than a week back, probably. And the vaccination drive has started with including healthcare worker in the front. So in the UK there is a criteria they have decided. So yeah, I was given email. Everybody gets an email or a call for the vaccination. They get a particular time slot and then you're called in for the vaccination.
Okay.
That's how we proceed.
Perfect. So I'll start with, I have actually made a set of questions for you. So I'll start with the thing. So when you were called for the vaccination, so what was it like? So you had to, how much time you had to wait for it? Was there some test done before the vaccination? How was it? Can you share your complete vaccine experience? Before vaccine, during vaccine, and post vaccine?
Yes. So the vaccine here I'm talking about is a Pfizer and BioNTech vaccine, which is the only one the NHS is giving at the moment. So it's all applies to the same vaccine. There may be different manufacturer with different regulations and rules, but for this one, I can share all the experience. So regarding the vaccination here, usually you get a call. There is a criteria where they have designed a standard set of questions for everybody. They email you. For the worker, it's easy. They will email on your email and then they will send you a questionnaire where you answer whether you are suitable for the vaccination or not. If you are, then you are supposed to book that vaccine. There is a good messaging app. And once you book the vaccine slot, then you will get the message instantly that this is your date of vaccination. At that time, on this date, you're supposed to come and get your vaccine done. There is no test required before your vaccination. You can go straight away for your vaccination, no restrictions. There are few contraindications, which I'm going to discuss with you subsequently. But you get this time slot, you go on your time slot. There is waiting time, I would say, at this vaccination center, it's around 15 to 30 minutes of waiting time before your number turns up. But otherwise, there's no waiting time.
Okay, so they have actually made a slot like this, like a half an hour slot or 1 hour slot. So many people come in the particular time in the slots and be vaccinated.
Yes.
Okay.
Yes.
So do they do any allergy check before the vaccine? Because many people had this apprehension, what if I'm allergic to the vaccine? So do they do something like that?
Yeah. So yeah, absolutely right. I think there has been 1 or 2 cases only of anaphylaxis with this vaccine, which is very, very uncommon, and it has been tested very, very widely, the Pfizer vaccine. So there is no need for any allergic testing. The only contraindication they put forth in the set of question is if you have a history of anaphylaxis, which is very severe allergic reaction, then you are not supposed to go for the vaccination. So this allergy could be to your food, to your medications, to previous vaccination itself. So if you have these situation in your history, then they will ask you this question, then you are advised not to go for the vaccination. Yes. And then what they do is after you had a vaccination for 15 minutes they ask you to wait there after the vaccination so that they can watch for any allergic reactions, and because most of the anaphylaxis happening within few minutes. If it is all fine, then you can go home.
No, but many people will have a small form of allergies to lots of things. Like somebody is allergic to maybe peanuts or something, to pollen or something. So is this like a mild allergy is also a contraindication, or is this a full blown like anaphylactic reaction?
Absolutely, it's a full anaphylaxis. They have not given any mild. They have only mentioned severe allergic reactions, anaphylaxis as a contraindication. It's not the mild allergic reactions, definitely.
So even the patient has some mild allergies, they should not be worried and they should be get vaccinated. But if in a life-threatening allergy situation in the past, that is the
Yeah,
basically a problem where the problem lies in.
that's the problem. Yes,
All right,
absolutely.
all right. So
Mhm.
so you got a vaccine. So you waited there for 15 minutes to see any kind of reaction happening to you.
Yes, I had to sit in the waiting area after, and everybody was sitting there. With, of course, with the full precaution of PPE, you have to wear at the center as well. So you have to wait for 15 minutes at the center. After the procedure, the nurse will come at the end, or the healthcare worker will come to help you. Okay, are you okay? After 15 minutes, if you're okay, go home. That's fine.
Okay, so
Yeah.
there is any kind of side effect that you noticed during vaccination or after vaccination, even a milder side effect, like I would say as small as like how painful was it, or is there any redness over the injection site or something?
Yeah. So what? So there wasn't at all painful. It was a very nice experience. If you get an injection, it was like you didn't even notice. That's very good. And the people needs to be trained. So there are trained people who have been trained in administering this vaccine. There are side effects which I mentioned. The first one is the sore arm, where you're getting the vaccine. So it is always given in the upper part of your arm, the right or left, depending upon. And most of the people will have numbness in the arm, in the muscles lifting the arm, which will be temporary side effect, will be for a day or two. Some people will notice fatigue and tiredness and headache. So these are the common side effects which we people will have.
Okay.
Very, very rarely people will notice high grade fever and the other symptoms which can be indicative of some infection, but I haven't only one or two people have noticed those symptoms, but most of the people manage with the mild symptoms.
Okay, so even you had this only soreness कि थोड़ा tight लग रहा है
Yeah,
आर्म में थोड़ा
yeah,
stiffness लग रहा है but it was
yeah.
not much. So if I
It
have
was
to
not.
compare it, so maybe we can compare it with some tetanus shot that we take. क्योंकि tetanus के बाद थोड़ा
Uh,
आर्म में और थोड़ा ये सब आता है. So is
I
this
would say less than, yeah. Yeah, I would say less than tetanus, believe me.
so that's a wonderful news
Mild,
because
yeah.
I believe कि सबने
Yeah, that's
tetanus
what,
तो कभी ना कभी life में some at some
yeah,
point of the
everybody
time
must
they
have
have
that.
taken it, so they can
It is
compare it.
less than that.
So it is less than that.
Yeah.
So
It is
that's
less than that.
good say for the
Yeah.
patients.
Yeah.
And,
Yeah.
okay. So any other side effect that you want to mention, like any nausea or vomiting or a dizziness episode or something?
So no, though I haven't in my circle, the people who have got, nobody has reported nausea, vomiting. It's not even mentioned as a side effect. Dizziness, not at all. If some people might be cause of the injection itself, but that's a separate isolated people, but it's not
Hmm.
a particularly a side effect of the vaccine. So no, I don't think so that should
And
happen.
how many people are we talking about when you say ki in my circle? Like it's just like a 50, 100 people or say more?
Oh, it is quite long. We've got a big hospital here. Almost everybody is getting vaccinated now.
Okay.
So I'm talking about and around 1,000 people here.
Oh, so thousand is a big number. So thousand may say if we say that only one or two people have developed even a milder side
Yeah,
effect, so it gives us a rough picture that it is a comparatively safe, and even those one two
it
has
is
just
quite.
got a milder side effect only.
Yes, all this.
Okay,
Yes.
so
So
that's
mild side effects.
yeah, I think that's again a good news. Okay, and any other restriction that they give you, like any travel restriction or any food restriction or any maybe alcohol restriction? Like Russian vaccine, I
No,
think
so
just pointed out that you should not take alcohol for like 2 months or so. So is
okay, I no nothing. No, sorry, I don't think so. There's anything. There's nothing mentioned. We were not informed any of these contraindication. Even also the vaccine, the agency doesn't mention that there is any restriction of food or alcohol or anything after or before the vaccination. No food restriction. No other travel restriction. You can walk into the center by yourself. You can drive away by yourself. So it is all safe.
oh, so you can drive even after post vaccination, you can drive your own car and go back to your place.
Absolutely, absolutely.
And is there like you have to, take some off from the work after the vaccination to observe any kind of side effects happening to you, or is it like the agle din se you can join your duty back?
None of us stop working. Most of the people have joined duty back. Only the people, somebody who reported some temperatures or increased fatigue or malaise, they tend to. But no need to take off from the work. If you're feeling well, there is no need to take the work. You can start working the same day.
So then I think that's another positive part about it. So what I take from all this is it is like
Mm.
what the routine vaccine that we take, like we adult vaccination to
Yes.
India may I don't think that is that common, but
Mm.
suppose we take
Yes.
a child for the vaccination, so it is like just like the same.
Mm.
Go and get your
Just
shot.
like the same.
Wait there for
Yes.
15 minutes to observe any kind of any side
Yes.
effect, and then you just go
Yes.
home and carry on with the life.
Absolutely.
And
Absolutely.
I
I
think
agree with
carry
you.
on with the life peacefully, more peacefully, because
Yeah.
you have been
Yeah.
vaccinated.
You will be more peaceful at the end that you got the first dose.
Definitely.
Yeah.
So when is your next dose planned?
So they said it's 21 day the first dose. They will give
Okay.
you a date slot exactly 21 days after at particular time. So you'll get the same slot. When you get your first vaccine, you'll get the date of your second slot on the same date. So whosoever comes in, they give you a card which is mentioned your second dose of the vaccine due on this
Okay.
particular date and this time. So you know that you're going to get the second dose in 21 days definitely. So that's
Okay.
the usual.
So
Yeah.
whosoever doesn't report back, maybe they will trace you actively that you should take your second
Uh,
to complete your course.
I something they're going to trace you because it's voluntary. This is not a mandatory one. If you don't report for your second vaccination, you miss it. There will be message, but there is nothing like a tracing because some people may not prefer getting the vaccine. Some may not want to do the second dose.
Okay, okay. So this was all
Yeah,
about
I
your
got it.
vaccine
Okay.
experience. Now I have a few set of questions, which how the UK government is planning
Yes.
for this vaccination drive. Because in India they have started making all the registration and collecting the healthcare and the personal data of people. So I just want to know
Mm.
how the UK government is actually practicing
Yes.
it, so that we can get an idea about the Indian vaccine implementation program.
Okay.
So, in UK, what
Yes.
I believe is there is only one vaccine that is available right now, and that is authorized. That is Pfizer, right?
Yes.
But I have heard that in
Yes.
US,
Pfizer. Yeah.
Pfizer
Yeah.
and Moderna both are approved as of now.
Yes. Yes. US both are approved. Yes. Yeah.
Okay, so
So
okay,
Moderna here is also being taken for approval, but it's still in the first phase. They've only launched with the Pfizer.
okay. But in India, I think that will be the biggest question: ki which vaccine government is going to launch. But I
Mm.
don't think that is on the user
Yeah.
side. That will be the on the government's part, which vaccine they are getting it available for, and
Yeah.
how they are planning to implement it.
Absolutely.
Hmm. Is
Yeah.
there any?
Yes. That's a big challenge.
Do you think is there any role of private vaccination also? That this part is the public vaccination driven by the government, but will that be
Yes.
available in the market? That if I want to choose, ki I want to take a
Mm.
Moderna vaccine instead of a Pfizer for my particular reasons, so
Yes.
will that be possible there?
Yeah. Not in NHS. NHS is totally government, and they have not given it to any private players because it's a quite robust system here. So they do not want any private player involved here. So you can't buy it privately, or you can't have it privately, because that's again a priority issues where which group of patients will get first. So it's a government prioritization. But I think in context of India, it is important that private players should be involved because most of it is run by the private players. So they should be involved. They should have authority to choose which vaccine they want to and then take it forward. Yes.
Yeah, in Indian scenario, I actually made a video. I think you saw it. So,
Yes, yes, I saw it.
usme actually this is what we were discussing, that this
Mm,
Pfizer Moderna, because they need such a strong storage capacity
I
and
agree.
minus
I
70
agree.
minus 20.
Yeah,
So
yeah,
maybe it will not be possible for the masses of India. So we
yeah,
might go for
absolutely.
some less stable, more
Mm,
stable vaccines which can be stored very easily, and then I believe the
absolutely.
private players might play a role, that if you somebody wants
Yeah, yeah.
for that.
Yes,
Yeah.
yes, absolutely.
Okay. So how what is the vaccination criteria policy in UK? How did they choose? Because you
Yeah.
cannot vaccinate the whole population in one go.
No, definitely. So there is phases. The first phase they have included anybody who is 80 years or more, who is coming to the hospital, has an appointment to the hospital, is going to get the vaccination
Okay. 80
few weeks.
years.
And Yeah, 80 years. So here the life expectancy is quite high. So they keep their bar at 80 years. So, and then all the healthcare workers will get it. Healthcare and social workers. So there's a criteria who is called healthcare and social workers. They've included doctors, paramedics, nurses, ambulance drivers, even the people who are working, who are going to have direct contact with the patients. So all they have been criteria with the health and social care workers. The
Hmm.
people who are living or working in the care homes, nursing care homes. So they are the people who are going to get on priority and in the first phase of the vaccination. And there is another, they're planning to get it to the community in people who are below 50 years but who have got comorbidities. They would also be included in the subsequent phases.
Okay, okay. So Indian government has also, I believe it's on the same pattern only, but instead of 80, they have put a criteria of 50 years, and less than
Yeah.
50, the comorbid criteria. But in
Yes.
India, my concern is that in UK, I think everybody is registered with the NHS, so they have the data of whosoever has this
Yes.
comorbidity or what. But in
Yes.
India,
Yeah.
I think we can find out
Mm.
about the age, but it's actually very
Yes.
difficult to find out ki whosoever is 40 years and has supposed
Mm.
diabetes. I don't understand how
Absolutely.
the government is going to find out
Mm.
that. Maybe self-reporting
I
will
don't
be
think.
there, or I
Yes.
don't understand. But I think government, we have to wait for the government policy and see.
Yes. Well, absolutely, that's a challenge. I agree.
Okay. And is the vaccine voluntary even for the healthcare there, or
Yeah,
is
it
this
is all voluntary.
even
Yes,
for
it
the
is all voluntary for everyone. Yes, yes. Everybody is a voluntary. There is no mandatory as such. They have left it to the people to decide. There's a form you will have to sign before the vaccination on the
okay,
center of the vaccination on your day, where you will sign the consent. Would you want to vaccination or do you not want the vaccination? You have the choice. You can even have first dose and reject the second dose. It's all voluntary. There's no
okay.
mandatory.
Okay, okay.
Yes.
But what is the public opinion over there? I'm thinking healthcare, I understand they'll be quite motivated for the vaccine because they know about the safety. But what about the masses?
I think everybody is quite motivated and they're hopeful because there's a quite good information government has sent over. There's a good robust study about the side effects and benefits of the medicine, and we know that the whole health system knows that the vaccine is the most effective way of controlling this pandemic. So people are quite they're quite optimistic. They want to have the vaccination.
But
It's just a phased manner of this to be launched. That's the only thing delaying
there is
things.
no subset of theories because I was reading some studies from the US also and lots from India that there are, whenever such drive happens, there is some conspiracy theories goes on. Okay, no, there will be side
Absolutely.
effect. How could they make a vaccine
Absolutely.
here or so? And there are so many conspiracy theories going on, but it is not there in so much in UK. People are
No,
motivated.
no. Yeah, people are motivated.
No, I
Yes.
think that's a really important part because
Yes.
personally I feel that unless we vaccinate maximum of our population, we cannot achieve
Yes.
a herd immunity, which is the basic goal of a vaccine.
Definitely. Definitely. That's a main. Yes. I agree with you.
So my next question to you is like some okay, I'll share my one doubt. That is my personal doubt. So if somebody has recovered from COVID and has
Yes.
already found the antibodies in his body, so does he still
Yes.
need to be vaccinated?
Yeah. So yes, absolutely important. It's a very good question. I think the people who have gone if they had got antibodies, they need to be vaccinated as well. But there is a criteria they have put on the NHS that if anybody has got swab positive within the last 28 days, they should not be vaccinated. So there is a 28 days criteria.
Okay,
If
okay,
suppose somebody has got a COVID around 40 days before, and then he had a swab at 30 days, which is negative, so he's good to go for the vaccination. But if somebody who has got a swab positive within last 28 days, even if he had a COVID around 30 days before, but he got a swab positive at 28 days, he will not be going for the vaccination. So that's an important criteria that within, if you have a swab positive within 28 days, you will not be, you should not go for the vaccination.
so swab positive means the RT-PCR test that we do from the.
RT-PCR, yeah. So, yeah, from the nose, yes.
Okay. So if I got a COVID on first of December, and
Yes.
so I can be vaccinated after 28 days, or is it 28 days after I turn out to be negative?
So it has to be a swab negative. So once your swab becomes negative, on that day will start your clock, and
Okay.
28 days after that, you will
Okay.
be able to get vaccinated. Yes.
Okay, because some people, in my knowledge, also I know few patients that they stayed RT-PCR positive for like 2 months or 3 months, because
Yeah.
RT-PCR can detect a dead virus
Mm,
also, and viral proteins also.
absolutely.
So
That's another
suppose if
fallacy.
you are negative for 2 months, even after you have recovered from COVID, so once you are negative
Mm,
after that, then your
mm.
clock starts calculating it, and after 28 days of your negative test, then you can be vaccinated. Okay.
You can be, yes.
Okay.
Yeah,
This is again a
absolutely.
very good question, because once
Yes, this
somebody
is
has
very
told that
good. Yeah.
they feel ki, why do I need a vaccine? I already had a COVID, I
Yes.
already had antibodies, but still they need to be vaccinated.
No, you still need, because this is an infection, it's going to happen again. So the vaccine is going to just reduce your severity. You can still get an infection. So the vaccine is going to make your immunity, going to boost your immunity more. So that's why you still need a vaccination.
Okay.
Yeah.
Another follow-up question about this. So, do you need the both the doses of vaccine as the routine schedule, or is there a schedule change or the dose change for COVID recovered patients?
So no, there's no change in schedule or the dose for the COVID recovered as well. You need both the doses to have a full immunity, and immunity actually starts few weeks after the second dose. So even if you have first dose or a second dose, you still need to follow the social distancing, hand washing, covering. All three precaution must continue, because the vaccine can still, even if you had a vaccine, you can have a COVID virus infection, and then it's just going to reduce the severity. That's the most important thing. So I think all the precaution has still to be followed.
Even after second dose of taking the vaccine, you still need to follow all the precautions.
Yes, yes, yes. So the biggest thing it does, it reduces the first thing it does is, of course, it reduces your severity of infection to the person who has got it. It reduces the patient's symptomatic rather than asymptomatic. So if more people are asymptomatic, there's less chance of transmission, they say, and more people have immunity. So I think it's going to be just as you talked, it's an herd immunity, it's a mass immunity which reduces the transmission of virus, and the most susceptible individuals become protected. So I think that's where we are thinking of. But still, you can get the infection. All precaution has to be followed. It's just like any other vaccine. The same precautions applies here.
Yeah, yeah. That's a very important point, I would say. Okay, my next question is there any, what is the vaccination program for children and the pregnant females or the females who are lactating? Is there any contraindication to vaccine for that?
Well, absolutely, very good question. The children, they have got a age criteria. 60, anybody who is 16 or more than 16 years only can have the vaccination. They're not recommended for children. Only with the children with severe comorbidities could be one considered, will have a very high chance of infection. But till now, the vaccine hasn't got a full data. And pregnant women, absolutely no. They have said not safe for the pregnant women. Lactating mother also no. So if somebody is pregnant, should avoid the vaccine till they have completed the pregnancy. If somebody is lactating, should, when they have stopped the lactation, when they're not when they're not breastfeeding the kid, they can have the vaccination. And also, any very important, if somebody's planning for a pregnancy in next 3 months, they should
Okay,
not go for the vaccination. So this is one, if you have got a vaccination, second dose, after the second dose for another 2 months, you should not plan for the pregnancy.
okay, okay.
That's what
So
recommended.
you have to take some basic precautions to avoid a pregnancy for the next
Yes,
3 months after your first dose or 2 months after your
yes.
second dose.
After
Okay.
second dose, yes.
That is a very important point, I would say, that you mentioned here,
Yes,
because
absolutely.
that can be a really concern for the younger population. Like, obviously, they might be planning, to get pregnant in recent
Yes,
future.
yes, that's important. Yeah.
Okay, and any contraindications? We have already talked about allergies. Is there any
Yep.
particular disease or any medications that if somebody is taking, or some diabetic patient is there, or HIV patient is there, or any form of immunocompromised condition is there? So is there any contraindication to the vaccine also, except for the severe allergy that you mentioned earlier?
No, there is no. Rather, they should be vaccinated because they're immunocompromised, because it puts them more risk of getting the COVID infection. So, immunocompromisation is rather more indication of having the vaccine. The only contraindication is pregnancy, lactation, and children 16 years or less than 16 years, and severe anaphylaxis. That's the only thing they have recommended.
Okay, and there is no other as such contraindication, no medication or nothing as in disease history also.
No, nothing, no,
Okay,
nothing mentioned. No.
that's another good point. Okay, now now the most important thing currently, what is the this new strain of COVID that is circulating
Oh
in
yes,
UK? You're working in UK, so I think you're the best
I
person
know.
to ask the question. And how does my vaccine is going to affect that?
Yeah, so I first thing is this new strain, whatever it is, it's not going to vaccination strategy. Very clear. So you should still, or anybody should go ahead with the vaccination. There should not be any impact on vaccination with the new strain. New strains are going to come over the time, so they are bound to happen in the virus. They mutates, but this vaccine is still going to protect you. It will still give you immunity against this virus. So this new strain which has come up, very little known about it. Still in the London area mostly. It has gone into complete lockdown at the moment. London area, very few cases outside the London region. So the thing is, people know very little. The only thing we know is very, very fast spreading, and almost 70% of the cases who are coming from now with the COVID are actually attributed to this new strain in the London area. So the only thing we know, it's 50% time more fast, easily spreadable than the previous coronavirus. About its virulence, nobody knows, but it is prediction is that it is less virulent than the previous COVID vaccine, previous coronavirus. So virulence is still doubtful, but people are getting clear on it that virulence probably is less. So that is more, it's more infectious than the COVID, previous COVID known strain.
So
So
virulence, as in ki the severity of the virus, it's not even the
exactly.
same. It is less than the previous one.
Yeah. Yeah,
Okay.
that's what is happening. But I told you the data is still getting more. The people are getting admitted, but as we are seeing, the virulence is less, severity is less compared to what it was before, and that's what the vaccine role comes. More people get vaccinated, less would be the severity. Even if the new strain comes in, doesn't make a difference.
So the vaccine will still work for the new strain. That is, I think that is clear, and I think WHO and many
Yeah,
agencies have favored the
yeah,
vaccines over this point.
absolutely, absolutely. Yeah, shouldn't
Okay.
be a trouble.
Okay, okay. So this was all I want to know about. But anything you want to tell about the Indian strategy of vaccination? Because this was all about UK, how UK has implemented it, and how
Yes.
healthcare is taking it, and what are the effects and side
Mm.
effects. We have talked it all. But in India,
Mm.
would you like to share something that you feel that India, how should they implement or like that?
Yes. Well, what I'm aware of the Indian scenario now is that they have come with almost 9 companies in the line with the vaccine, and that's a good strategy Indian government has taken because no one manufacturer can supply such a big population. So I think that's
Yeah.
a very good strategy to include multiple manufacturers because almost all have got a good efficacy for this vaccine. The other concern in Indian is about temperature and cold storage, which is really a real problem with the Pfizer vaccine. But I think the other ones which are coming in the market may not have that exacting temperature storage requirement. The the other problem is, of course, the population. It's a huge population to cover, and they have come with a plan to go for the workers and the first line workers as a first policy, and anybody who is more than 50 years with or less than 50 years with a comorbidity. So and the one thing I like is about they have got some app-based registration for this vaccine. Probably that's a good initiative by the government that if they introduce this kind of app, that they know which people are getting vaccinated, people will be more informed. The only
Hmm.
suggestion, what I and you have explained as well, that to involve the private players as well to get into the vaccination drive because that's the best way to most of the masses in the India because you can't send the government people everywhere to give the vaccination. And the other thing is, of course, when you involve the private player, the government has to be watchful in seeing that the policies adhered to, that whoever is vaccinating they follow the guidelines and what is mentioned by the government, and the cost of the vaccine needs to be regulated as well if that goes in the private hand as well. um, I think that's the main thing which is prevent which is need to be taken by the government. And I think you already mentioned that. Yes.
I think you have covered almost all the points, but I would like to highlight that whatever you were saying, I could feel that government has already done like 80-90% except for involving the private players and regulating the cost. But I think
Mm.
that will be the last minute decision. But the
That would be the good.
administration, the phasing supply, and choosing the best vaccine out of all the players in the line. I think government has
Yes.
already done. Government is on the right track. That would I would like to
Yes.
sympathize with that. So
Absolutely.
I
and
think what all is
and
left
one
is
thing.
to motivate people and to drive people,
Yes.
just to take it. Because in India, I think it is also going to
Mm.
be voluntary only. You cannot actually compel anybody to take a vaccine.
You can't.
So
You
I think it is
can't.
just a vaccination drive and motivate people. But I think with your experience and what you have shared with me, I personally feel more motivated, and now I can be more confident in telling somebody, okay, go and go vaccinated. There is no actually harm in taking a vaccine.
Absolutely, we need to. I totally agree with you. The vaccine is the way forward, and the people should not be scared of the vaccine, and they should really come and they should volunteer for having the vaccine, because that's the best interest of the whole population. Because more people who come forward, more we have the herd immunity, more get vaccinated.
I think that's a good take home message of this conversation, that everybody should be vaccinated to build a big herd immunity, and
Absolutely,
that is the only way to stop this pandemic. So I would really thank you, Dr. Pankaj, for giving us this time. And
absolutely, I agree
I
with you.
understand you are in hospital again, and you
No problem.
spared a few minutes to
My
talk to
pleasure.
us. So I think we'll end this here. But
No
I'll
problem. No
really thank you
problem.
again for that. Thank you.
Thank you. Thank you, Vineet. Thanks. Thank you so much.